we are very pleased with the continuing focus on testing in South Australia. The numbers were slightly down on New Year's Day, but still 21,140 tests which were conducted in South Australia. So a big thanks to those people that are coming forward. And we're also pleased to report that we are seeing an increase in the symptomatic testing, which is exactly and precisely what we've been messaging for the last couple of days. We want to preserve those tests for people who are going to have symptoms and more likely to have the disease. We want to get them into isolation as quickly as possible. In terms of the numbers, yesterday we had 2,298 positive cases in South Australia, so around about the same place that we were the day before. Thank you to everybody who came forward. We currently have 82 people in hospital, so we're still very much within our current capacity with our hospitals, and that's before we take action to put that new elective surgery direction in place, which will be coming in certainly in the coming days. Currently we have 7 people in ICU. And there is again a movement in and out, both of ICU and in terms of hospital. We see a lot of admissions, but also a lot of people who are leaving hospital on a daily basis after their conditions have stabilised. So grateful thanks to everybody who has been involved in the testing and the hospitalisation of those people whose situation has deteriorated. As you would be more than aware, the vast majority of people now who are COVID positive in South Australia are being looked after with our community response team, which is managing those people within their own home environment. So SA Pathology will be going back to normal hours of operation. Of course, we had changed hours of operation over the last 2 days with extreme weather conditions. We're back now to that arrangement. In terms of the vaccination, though, we did have a drop-off yesterday. Now, I know it was New Year's Day, but there was a lower number of people that were vaccinated yesterday, and in fact most vaccination clinics across South Australia were reporting that there was plenty of spare capacity. Again, I spoke to lots of people who booked in the morning, had their vaccination in the afternoon. This is a disease which doesn't take New Year's Day off. This is a disease which we really need to be taking very, very seriously, especially the new Omicron variant. So my strong advice to the people of South Australia is we are massively surging our vaccination capacity in South Australia today. A further 1,000 appointments were made available at Wayville. We really need to see each and every one of those taken up. There are now tens and tens of thousands of people who are due for their booster. Our focus at the moment is trying to get all of those people that need to get that booster, that are eligible for that booster, through as quickly as possible. This will give you your very best protection against Omicron. I can also report that the situation that we reported on yesterday with regards to Port Augusta is not quite as severe as we thought. Yes, there are 3 people in the local area in the Aboriginal community who have tested positive, but we have approximately 32 to 35 close contacts of the person who is working within the Sobering Up unit. They have all had a rapid antigen test now, no positives whatsoever. So we are going to modify our plan. We will not be bringing them down to Adelaide. We'll be accommodating them at the Westies footy oval and monitoring their situation there. So it looks again like we've dodged a bullet with a very vulnerable community in Port Augusta. It was one that at yesterday's COVID Ready Committee meeting we were very concerned about. We put all of the contingencies in place. The great news is those rapid antigen tests came back, no positives whatsoever. We've done almost all of those close contacts, so that's very, very good news for the Port Augusta community. Unfortunately, it's not the same situation within our prisons, so we now have 60 COVID-positive patients within our prison system at the moment. The majority of those are at the Mobilong prison, but we also have people within the Adelaide Women's Prison and also the pre-release centre in Adelaide, and we now have 1 positive case amongst a worker at the Port Augusta prison. So, look, this is pretty commonplace around the country as we deal with Omicron. We see a big number of COVID-positive prisoners in the system in New South Wales, in Victoria. We've put very strict arrangements in place in terms of visitors into our prisons. This is a vulnerable community, and it's one that we have to take very, very seriously, and unfortunately we have had a deterioration in that situation the Chief Executive, David Brown, Minister Vincent Tarzia are monitoring that on a very close basis, and hopefully we've got some better news to report to you tomorrow. But again, the strong message today is that yesterday, New Year's Day, there were plenty of opportunities to get vaccinated, to get boosters, to get those jabs into the arms. They weren't all taken up yesterday. We don't want that situation. We want to have a big surge today, tomorrow and into the future to get as many people vaccinated as we possibly can.
Premier, do you have a breakdown yet on how many children have contracted COVID-19 in the last 24 hours and how many are in hospital?
I don't have that, but that might be on the EPI report which comes out later. What I can tell you is there's been a reduction in the number of children in the Women's and Children's Hospital. Yesterday I think I reported 10, it's now down to 7, and so that's a pleasing trend within the Women's and Children's Health Network.
And is there any update on vaccine supply for children aged between 5 and 11?
No, as I said yesterday, that is on track. We had Lieutenant General JJ Fruin, who is the person coordinating vaccinations right around the country. He's been turning his mind over the last 2 months to the opportunity to get this paediatric dose in place. That's now coming into the country. We've already got the first doses in Australia now. That's being distributed to each of the states and territories, and we're ready to go as of the 10th of January. And then, of course, we'll be getting more and more doses which come in. It is a different formula, and there is a different length of time between doses. And so it is actually an 8-week gap between the first and the second dose. And, of course, it's a far milder dose than what the adult population has had. So if you've got a child or a grandchild or somebody that you care about between the age of 5 and 11, it's a really good opportunity now to get online and to book in for that paediatric dose to make sure that your child is going to be as protected as possible.
Given the surge in cases among children, we've got 30 days until school starts. Has there been a plan to look at how that will happen? Are we thinking of delaying the start of school term? Yeah,
no change since the press conference yesterday, so we're looking at all and every option with regards to the resumption of school in term 1 later this month. It will be a big day for our schooling system in South Australia. It will be the first time that we've had Year 7s in that secondary setting. We're not so concerned about those of course, that are 12 and above, because they've had the opportunity to have that dose. And so they're going to be far more protected. It's the 5 to 11-year-olds that we're concerned about. We're looking at all options, both within our own system, the independent system, the Catholic system in South Australia. So we're trying to do that in a coordinated way based upon the latest knowledge, and that's still coming in on a daily basis from right around the country, right around the world. But you're quite right, we are concerned about numbers in the children's population. We saw this particularly over in the ACT, where they had a large number of young people infected, and we're particularly concerned about Omicron. So as soon as we've got further information with regards to that, we'll be certain to update parents and, of course, the people of our state.
When it comes to restrictions, when are we likely to perhaps bring some of them down, or on the flip side, what might trigger them to ramp up, or where are we at with that?
So, look, we're putting restrictions in place in accordance with where we are with this disease. Omicron is a complete and utter game changer for us here in Australia. Just when we thought we had the measure of this disease with Delta, we now have this new wave, Omicron, which is highly transmissible, much lower level severity. But we had to take action on the 26th to make sure that we could slow the spread of this disease down so it wouldn't overwhelm our health system in Australia, more particularly here in South Australia. This gives us more time to flex up our capacity with regards to hospital beds, ICU, getting all of the personnel in place, and also giving us that greater opportunity to get as many vaccines into the arms of South Australians. That's going to be the very best level of protection that we can possibly get at the moment. We're seeing numbers around the country surging with Omicron at the moment. That's why we took action to get on the front foot to slow it down in South Australia. And as I reported yesterday, absolutely delighted with the decreased mobility here in South Australia. We saw that on New Year's Eve, and again I want to thank every South Australian for doing the right thing to protect themselves and their families and the broader South Australian community.
So there's no date on when we might bring those restrictions down?
No, there's nothing to report today on that.
On October 15th, you announced the COVID Ready plan.
Yes.
Part of that plan included Parkwind Hospital.
Yes.
We understand that the government has the lease already.
Yes.
It's been signed. When do those 23 beds come online?
So that we always said right from the beginning that they would come online when they were actually needed. Since then, of course, we've flexed up the other available beds to us right across the system. And so the COVID Ready the COVID-ready expenditure that we had was originally for Delta. We've significantly flexed that up, and that additional capacity comes on when it's needed. As you can see at the moment, with 82 hospital beds taken up with people that are COVID positive, we are well within our current capacities. Just the 7 people in ICU, and that is very, very well within our current capacities. But if we require the further flexing up of the system with Parkwind, then we'll put that into place. We have that lease and it's ready to go.
The opposition says...
At what point will that be needed? Is it once we hit 100, then we need to open up Parkwind, or...?
No. Look, Parkwind would be right towards the end. We've got some other very good options, and those being put in place at the moment. The reality is we'll bring that additional capacity on when we need it. And as you would have seen in the last couple of days, we've talked about the need to put a ban on all non-urgent elective surgery in South Australia to provide us with further beds, but also, importantly, ICU capacity. Parkwind isn't suitable for ICU. And so it's possible that we're going to change the use of Parkwind down the track, but we've got plenty of capacity in the system at the moment. But it is still important for us to slow the spread of this disease, and secondly, to get as many jabs in the arms as possible.
The opposition...
having elective surgery cancelled and those people that have had their surgeries cancelled, and the fact that we will be paying, taxpayers will be paying for the lease of this hospital, which is empty, do you think that's a bit of a kick in the face?
No, I don't think it's a kick in the face at all, odd expression. But look, the reality is we've got to take precautions. We did this in the early stages of the disease as well. You might remember we commissioned the Wakefield Hospital College Park. We ultimately didn't use either of those facilities, but you've got to have some facilities on standby, ready to flex up if they are needed. And the owners of Parkwind were very happy to make sure that that facility was available and as and when we need it, but we certainly are nowhere needing that facility at the moment.
How many people have had their third dose, like percentage of people eligible have had it, and overall, how many have had their third dose?
Look, I don't have those statistics with me at the moment. They come off the Australian Immunisation Register, which is controlled by the Commonwealth, and as you would know, we have actually changed the availability in recent weeks. There have been 2 separate decisions. Originally, the booster was only available after 6 months, then it was brought down to 5 months, and then to 4 months. And then here in South Australia, we made some available from the 26th. What I know is that there are tens and tens and tens of thousands of people who are now eligible for the booster, and my strong message to them is book in. Go and have that booster as soon as you possibly can, because you'll be protecting yourself in terms of contracting the disease, transmitting it to a loved one or a work colleague, but you're also going to massively reduce the severity of symptoms should you actually contract Omicron. Omicron is highly transmissible, but we can mitigate against the severity by making sure that we're as protected as possible. There are a huge number of vaccination appointments that are being opened up on a daily basis. We are massively flexing up our capacity in South Australia. Now we need to partner with the people of our state to make sure that they can book in for them. Now, I know yesterday was New Year's Day, and so plenty of people were maybe kicking back a little bit and resting after New Year's Eve. But we did see the number drop yesterday. That was not what we wanted to be seeing happen. So we've flexed up the capacity again today, and we really need to see people booking in and going and having those jabs.
With changes to quarantine interstate and international arrivals, are the Medi-hotels still required? Is there any intentions of dropping the amount? Or?
We still need the Medi-hotels for people that are unvaccinated. They still are required to do 14 days of Medi-hotel supervision. But we also are using some of our capacity to use it for people who can't safely quarantine at home. They might have a large family, might have a large vulnerable family, they may have special needs, and so we do need to provide those alternative arrangements for people to be isolating, whether they're close contacts or whether they are COVID positive. So we've kept the vast majority of all of our Medi-hotel capacity in place, and again, we're not fully utilising it at the moment, but we still are weeks away from the peak of this disease, and we've got to take all precautions possible.
Are we likely to hear from Professor Nicholas Spurrier in the next little while?
Yeah, I'm sure she will coming out soon. She's not in Adelaide at the moment. She was just on a call with me today, and also there was a big round table that was held this morning with regards to vaccination and ramping that up, which she was on with Dr. Chris McGowan.
Given what we know now about cases of Omicron amongst our children, you had your time again, would you delay the opening of the borders?
It was a different time. So we opened our borders on the 23rd of November in accordance with the Doherty Institute modelling. And look, quite frankly, if it wasn't for Omicron, this would be almost a textbook opening. We've had very few Delta cases that have actually ended up in hospital. So we'd really planned for that extraordinarily well. Omicron was only notified to the World Health Organisation on the 24th after we opened our borders. And in fact, I think it was only declared a variant of concern on the 26th or the 28th of November, so well after we opened up. Look, our personal belief is that our professional belief is that it's very difficult to stop Omicron anyway. We're already seeing a huge number of cases now in Western Australia, and this is a state which has been completely sealed off. What we've got to do now, when the rules of the game have changed, is make sure that we're updating what we're doing in South Australia and getting on the front foot. And I'm quite sure every single shoulder is to the wheel at the moment within SA Health, within SA Police, and most importantly with the people of South Australia. They get that Omicron is different. It's very different from Delta, and now we've got to respond. But just like we responded to earlier waves and outperformed the rest of the country and the rest of the world, I'm quite sure we'll do exactly the same with Omicron. But we do need to be very careful, especially at the moment, just to slow the disease down, get those additional boosters in arms, flex up our capacity within our hospital system. It is going to be a tough couple of weeks. We are going to see increasing numbers, but I'm quite sure that by getting on the front foot on the 26th of December and giving the pretty tough message to people that they had to really be very mindful of safety over New Year's Eve, then I think that we have been able to put ourselves in an extraordinarily good position. I'm certainly of the opinion that Omicron is difficult right around the world, and there'd probably be no better place in the world to be at the moment than in South Australia with our excellent response with SA Health.
But when Omicron did rear its head, there were people within SA Health that said and told you that the borders should be closed. So
no, that's just not correct. I've gone through this in previous ones. I'm happy to go through it again. There was a directions meeting, and that people come to that with an initial set of options, and one option that Professor Sperry said is, look, we could actually, 4 days into the knowing about this, we could shut the borders, but there was a consensus decision, which was made. Certainly all the information that we had at the time informed that directions committee. I think we probably would have been the only place in the entire world that closed the border. It was something that was considered, but ultimately a decision was made to proceed.
But now we have children aged between 5 and 11 who'll be waiting weeks now for a vaccination. We know for a fact that children are now ending up in hospital with the virus. So can you understand the concern of parents? And could they be thinking, well, maybe South Australia should have been the only state in the world to make that decision? That was actually an opportunity.
Yeah, look, I think what we've done in South Australia is keep people protected right since day one. It's probably one of the safest places to have been in the world over the last 2 years. Now we are confronted with a mighty battle on our hands, but just like we've risen to the challenge with previous waves, and we'll do exactly the same with Omicron, I think that it's a great partnership. As I said, health professionals, SA Police, the government more broadly, and then, of course, the people of South Australia. Of course, there's going to be a huge amount of anxiety at the moment when a new variant is found. How are we going to respond to this? At the moment, what we know is it's far more transmissible, but the severity is much, much lighter. And because we are a couple of weeks behind the front interstate, we can learn in terms of the way that they're managing those cases through their hospital, the different treatment methodologies, and then apply them to us here in South Australia. And I think that our transmission potential in South Australia will be lower than what happens interstate, because I just think that we are being far more cautious in our state than other places.
We've got the Adelaide International coming up.
Yep.
Will unvaccinated players and spectators be allowed?
No, my understanding is it's a fully vaccinated tournament, and that was a decision from Tennis Australia.
And are you looking forward to the economic boost it will bring to Adelaide, or is it less than you had hoped given everything that's going on?
Oh, look, my focus at the moment, quite frankly, is 100% on the Omicron variant and making sure that we can get through this pretty tough period. I think it is great that we've got some of the best tennis players in the world at Memorial Drive. There's a lot of tennis fans that will get along to those games, and they'll do that in a COVID-safe way. But there's also going to be huge broadcast right around the world, and I think we'll be showcasing South Australia and Adelaide in particular in a very positive light. We're the #1 most livable city in Australia, the #3 most livable city in the world. The weather is fantastic, and I think the shots of tennis players beaming around the world will be fantastic for promotion down the track.
Are there things that we learnt from the Ashes that will be implemented for this next tournament?
Yeah, so we obviously, after every single event, which is what we call a COVID management plan event, we sit down with the organisers and we talk through what went well, what areas we could improve, and then they inform the next COVID management plan opportunities. I think we have something like 19 COVID management plan events in South Australia over the next 30 or 40 days, and we're constantly working with the organisers to update those based upon the very latest that we learn about Omicron.
Callers to the COVID hotline are receiving a message that says they're experiencing a high volume of calls and then it hangs up. Are SA Health able to keep up with demand at the moment?
Yeah, same question as we had yesterday, and it's the same answer. There are periods where we haven't been able to get to all of those calls. They don't come in neat 5-minute gaps. Sometimes they all come in at once, and there sometimes is a surge. But we have also very significantly surged our workforce to answer those phone calls. As I reported yesterday, one of the things that we've done is to get the public service to work from home where possible, but we've also enabled the public sector mobility mechanism, which allows us to transfer people from one department to another so that we know that we've got our resources dedicated to those things which we need to be focused on as much as possible. So I know that yesterday and again today there have been some delays. We apologise for this, but we have very significantly surged those numbers. But we are in a situation where we are having far more numbers call in to that switchboard. Well, obviously there's a huge amount of information on the SA Health website, and of course those people that are COVID positive are being managed through our community response critical care team, and so there are a number of different avenues. But if it's a general inquiry, mostly the information is contained on the SA Health website. But if people are genuinely wanting to get some clarification, and look, this has been a very confusing Omicron variant for the entire world, and sometimes the information that was provided 2 weeks ago needs to be updated, so people should feel free to ring in. If we can't answer it immediately, of course we'll be doing that as soon as possible. We've significantly flexed up the capacity within that response team, and we'll continue to do that as people come back from leave.
There's been a Facebook ad saying there are 1,000 extra appointments available for vaccinations, and people are logging on and they're not getting these spots, and they're saying they've never put online. Is that the case, or are people just...
Look, as I said, I was only speaking to people again last night who logged on in the morning and got an appointment at Wavell on the same day, and today there's 1,000 more appointments available at Wavell than there was yesterday. It is important to often, if there are no appointments available, to go in and refresh if you do have the capacity to go and get yourself vaccinated today, because sometimes people drop out and so appointments become available. But my goal and the goal of the entire team, and one of our Assistant Commissioners, Noel Bamford, is really focused on how we flex up this vaccination capability and capacity in South Australia. We're looking at all and every opportunity to get those jabs into the arms of South Australians, because we know this is the best way that people can be protected from contracting, transmitting the disease, but also it will significantly reduce the severity of the symptoms if they do contract the disease.
Do you think there's enough incentive for people to get boosters? I mean, we saw the big surge when it had to be fully vaccinated to be able to do certain things or work.
Yes.
Do we need to change the definition of fully vaccinated?
Yes, so we've done that a couple of days ago, so we've now made it mandatory for people in those frontline areas to have the 3 doses, and this will be the subject of a change direction. So it is really important that those people that are going to be the most vulnerable do get the booster as quickly as possible. So these are people that are in residential aged care facilities, they're in disability settings, but they're also people on the front line working with people in the hospital setting, in the disability sector, and of course in the residential aged care facilities. We've seen these as very vulnerable cohorts, and that's why we've had to make those jobs mandatory for vaccination. It was not always met with great acclamation, but I'm quite sure that it was a really important message to be sending to everybody working in that sector, is that vaccinations, high-level vaccinations, is definitely going to save lives in South Australia.
Last questions, please.
Okay, thank you very much. See you tomorrow.